I'm Dr. Nanda Rajaneesh. I practice in Apollo Spectra and Mazumdar Shaw Cancer Center. I basically handle laparoscopic surgeries and breast cancers. Women above 50 with a positive family history definitely has increased risk of breast cancer. Risk increases by 3 times if it is a first degree relative, like her sisters have suffered from breast cancer, her daughters have suffered from breast cancer, or her mother has suffered from breast cancer, and her immediate relatives have suffered from breast cancer, that is called first degree relatives, then the breast cancer risk increases by 3 times. But if second degree relatives is present, breast cancer risk increases by 2 times. So if any women, as such all women are prone for breast cancer, as we have a breast tissue, excessive breast tissue on the chest wall, and age itself is one of the factor influencing the breast cancer, which can increase high risk cells in the breast, and there are many other high risk factors which make women to get breast cancer. But if there is a strong family history, these women require certain tests which can help you to prevent or detect early breast cancer. One could be doing a BRCA test, that is doing the genetic test to find out if you are BRCA1 or BRCA2 positive. If you are positive, you are likely to get certain cancers including the breast cancer in the body. So what we recommend to these women is that they have to do a routine, regular, aggressive screening of the breast. That is, if the chance is 100% that they are going to get breast cancer because of the BRCA1 and BRCA2 positive genetic test also being positive, and if there are other risk factors influencing them, in that case, there are many options that we give to these women. As I said, aggressive follow-up is one thing. We give a drug called Tamoxifen, which is a hormonal prophylactic drug we give to prevent breast cancer. And we can also do what is called a subcutaneous mastectomy in these women, that is removal of all the breast tissue with the nipple sparing, which many well-known people also have done if there is a family history of breast cancer. And that is offered to women very often these days, because they would not rather have breast cancer and end up in chemotherapy and radiotherapy, then going through the process of subcutaneous mastectomy and implantation of the breast. So you will have a normalcy with that. So that is what we recommend if there is the increased risk of breast cancer due to family history. But if women do not want to do subcutaneous mastectomy, as I said, we can recommend the hormonal prophylactic medication to suppress the high risk cells and increased dietary factors and environmental factors protection, and check vitamin D levels. If it is deficient, please correct the vitamin D levels in the body, and do a routine screening of the breast. Meet the doctor at least once in a year, but in women with family history, we tell them at least twice a year it is better that you meet your doctor, and if required they will recommend whatever test that needs to be done to find out if there is any high risk of breast cancer cells in the breast.